Hi, my name is Hiam Hamoud. Here's my license. And here is the consent form for my patient. Hi. Hello, my name is Hiam. I'm going to be your nurse today.
Okay.
Can you please state your name?
Vicky.
Vicky, and can you tell me your date of birth?
October 16, 1993.
Okay, and are you married?
No.
And do you have any children?
No.
And what would you say your race is?
Caucasian.
Caucasian, okay. Can you please tell me why you're here today?
I cut my finger.
Your finger, okay, so that's where the main pain location is? Okay. And can you tell me how you did that?
I was in the kitchen and I kind of sliced it off a little.
Oh, okay. And can you tell me how the pain feels?
It's a throbbing pain.
Throbbing, okay. And can you rate the pain for me out of 10?
It's about a 3.
A 3 out of 10?
Mhm.
Okay. And what makes it better or worse?
The gauze pressure on it kind of relieves it a little bit, so
Okay.
it kind of
And do you
helps.
feel like a constant pain or is it come and go?
It's a constant pain.
Okay. And what other symptoms are you having with your finger? Like, do you have any signs of infection? Any like drainage? Is there anything coming out? Do you see any pus or yellow discharge?
No.
Okay. And how would you say this is affecting like your daily living? Like, do you feel that it's like dramatically affecting?
Yeah, I can't pick things up with this hand.
Yeah.
So.
Okay. I see. So moving on to your past medical history, can you tell me if you have any like major health issues?
No, just maybe some seasonal allergies, but
Okay.
nothing else drastic.
And do you take anything for your seasonal allergies?
Yeah, I just take Claritin if need be.
Every day?
No, just whenever I feel a little stuffy or runny nose, but
Okay. And are you up to date with your immunizations?
I am.
Okay, great. Moving on to your family history, I'm just going to ask you a couple questions about that. Your father, your mother, your grandparents, your siblings, aunts, uncles, do they have any major health issues that we need to discuss today?
Just my mom has high blood pressure.
So your mom has high blood pressure.
Mhm.
What age was she diagnosed?
About 50s.
50s? Okay, and can you tell me what is it being controlled? Is she seeing a physician?
Yes. So she's seeing her doctor's giving her some medication, the metoprolol.
Okay.
And it's under control.
Okay,
now,
great. And anybody else in your family have any major health concerns?
No, just my sister. When she was younger, she had some diabetic problems, but it's under control also now. She's regulating it with medication.
Okay, awesome. And your mom and your sister, are they the same race as you?
Yes.
Okay, cool. And so talking about your social history, I'm just going to ask you a couple questions about that. Do you drink?
No. Oh, yeah, I do. I'm sorry. Yes, I do.
Okay, how often?
Just a couple times a month, maybe 2-3 times a month.
Okay. And do you smoke?
No.
And do you do any illegal drugs?
No.
Okay. And do you exercise at all?
Sometimes.
Like how often?
Like 2-3 times a week.
Okay. And how would you say your sleeping schedule is? Do you feel like how many hours of sleep do you get a night?
Like 5 or 6.
5 or 6 hours?
Mhm.
Okay. And what do you do?
I'm a nurse.
You're a nurse also. Okay, so makes sense why you're not sleeping. So do you have like your ADN or your BSN or?
ADN. Associates.
Okay. And where do you work?
Providence and Southfield.
Okay, cool. And I just wanted to ask about your diet. Can you explain to me what you ate in the last 24 hours?
I had a granola bar and yogurt for breakfast, an apple for like a snack. I had a chicken sandwich and another fruit before dinner. And for dinner, I had chicken breast with some vegetables.
Okay, that sounds pretty healthy.
Mm-hmm.
And what about your water? Like how much water do you drink a day?
I drink about 33 ounces of of water, like 2 of those. I'll drink 2 big bottles like that.
Okay, that's good.
Mm-hmm. And then like maybe like 2 glasses of coffee in between.
I see.
Yeah.
Okay, cool. So generalized speaking, I just want to talk about your overall health. Did you notice like any weight changes, losing weight? Did you notice any, feeling like just not yourself or nausea or vomiting or like fever or any night sweats, chills?
No, I think the only thing would be just the weight loss, about 5 pounds.
Was it intentional?
Yeah.
Okay, so you're I see that you're eating pretty healthy, so
Mhm.
and you're exercising, so you're trying to lose some weight.
Mhm.
Okay.
Yeah.
And just talking about your skin as a whole, have you noticed any recent changes in your skin? Any lesions you noticed, or pigmentation changes, or bruising, or rashes?
No, nothing drastic. Just acne here and there, but it clears up, so I'm not too worried about it. I don't keep up with it, so
Okay, and skin wise, do you go out in the sun a lot?
no, I
Okay.
don't.
But if you do and go out in the sun, do you wear any like type of sunscreen?
Yeah, I usually wear like it's called Neutrogena. It's like the 80% SPF or 75
Oh.
SPF. It's a pretty high one,
Okay,
so.
that's pretty good.
Mhm.
Okay, great. Moving on to your hair and your nails. Do you feel like your nails are a little brittle at all, or any hair changes, hair falling out?
No. Mm-mm.
Okay, great. And talking about your head, do you feel like you're not fully there at times, like you're fogged, or do you have a headache at all, or some dizziness?
No.
None of those?
No.
Okay. And talking about your eyes, did you notice any like vision changes, any dizziness? Double vision. Sorry.
It's okay. No, just maybe some itching for like whenever I have my allergies, but it just stops after I take my medication. So
Okay. And when was your last eye exam?
3 months ago.
Okay.
Yeah, 3 months
So
ago.
you're pretty up to date with
Mhm.
that. And then moving on to your ears, have you had any ringing in your ears, or recent ear infections, or ear pain,
No.
or any issues with like off balance?
No, just again maybe the itching for like allergy wise, but
Mhm.
nothing balance wise, no pain, nothing.
And you've seen like ENT recently and got your hearing checked or anything like that?
Yeah, I got my hearing checked a little less than a year ago.
Okay. And moving on to your nose, mouth, and throat,
Mm-hmm.
have you seen noticed any, or had any recent infections in your throat, or noticed any gum changes or teeth, or any drainage coming from your nose or sinuses?
No, just I'll get like drainage from my nose again for my allergies.
Yeah, so it seems like a lot of things are relating back to your allergies.
Mm-hmm.
Okay, and talking about your neck, do you have any like neck stiffness at all? Do you feel like sometimes you can't really move too well, or anything like that? Neck pain?
No.
No. Okay. And talking about like under your arms, do you feel like any lumps there, any pain? I know sometimes people can have like ingrown hairs. Have you ever experienced that?
No, but I don't feel anything.
Okay.
Underneath.
And your breasts. So, have you noticed any changes in like the nipple area, any dimpling, any discharge? Have you felt for any lumps?
Yeah, but no changes like that. No
Okay. And do you
discharge
do
or anything.
like self breast examinations, everyone?
I tried. Yeah.
Yeah, I know it's tough to remember.
Yeah.
So, moving on to respiratory, with your allergies or anything like that, have you ever had like any wheezing going along with it, or any respiratory changes, any chest pain, cough?
Mm-mm.
Okay, good. And what about cardiovascular wise? Did you notice any changes? Like, do you have like a faster heart rate at times, or do you have any chest pain or shortness of breath? No. Okay. Do you have any edema in your legs or feet after standing up on working 12-hour shifts?
No, just my feet feel sore, but that's all.
Yeah. Okay, that's pretty normal for a nurse life. So vascular wise, do you feel any like numbness or tingling in your feet or anything like that?
No.
Okay, great. And talking about your stomach now, do you have any, distension or any changes in your bowel movements, or more bloated, extra gas, anything like that? Maybe sometimes could be related to your diet.
Just from the diet, maybe it just depends on what I eat, but
Yeah.
no stomach pain.
No changes in your stool or anything like that?
No.
Okay, great. And talking about your urinary system, so do you notice any changes in, like any frequency or urgency, or have you ever had a UTI recently, or any burning when you're urinating?
No.
Okay, have you noticed a change in your urine, like the smell or the color?
No changes.
Your urine's clear,
Mm-hmm.
not cloudy?
No.
Okay, great. And I'm going to ask you some personal questions, but about your reproductive area. So your menstrual cycle, how old were you when you first got your menstrual cycle?
About 13, I think.
Okay.
Yeah.
And when was your last period? This is the hardest question.
Yeah. It started, what's today's date? So it was on the 13th.
Of last month? Or this month?
This month.
Okay, cool. And how long does your period usually last?
About 4 days.
Okay. And other than that, have you noticed any like vaginal discharge that's different or excessive amount of discharge?
No.
Okay. And are you sexually active?
Yes.
And do you use protection?
Yes.
And did you ever notice any signs of STDs or anything like that? I know this is a personal question. I apologize.
Mm-mm.
Okay, good. What kind of protection do you use again?
Barrier method.
Okay.
Condoms.
Okay, and you're not on any birth control?
No.
Okay. And skeletal wise, do you have any changes in your joints or feel like you're aching or anything like that? Or stiffness? You know, I know sometimes it could be to weather or stuff like that. Do you have any like arthritis or anything like that?
No, just maybe my legs will hurt after I'm working, but
Yeah.
no changes with like muscles, aches, and stuff like that. Nothing.
Okay. And neurologically, have you seen any changes that way, or have you like fainted before blackouts or can't remember? You know, your memory's deteriorating. Anything
No.
like that?
Mm-mm.
Okay. And about stress management, how do you cope with stress?
I usually either try to like talk with a friend or just try and just do some breathing exercises. But
That's a good idea.
yeah,
Do you also look for exercise as a?
sometimes as much as I can, I try to exercise, but can't really try that much
Yeah,
with work. And
Yeah, the work schedule's hard.
Yeah.
So bleeding disorders, like, do you feel like sometimes you bleed more than often, or you bruise very easily? Like, how long would you say like it takes? You know, the cut on your finger, was it bleeding excessively, or does it stop when you apply pressure after a certain amount of time?
It stopped when I applied pressure. It stopped after a couple minutes, but it wasn't. It didn't take too long for it to stop.
Okay, good.
But yeah, no bruises, nothing in that sort.
No, nothing out of the ordinary. Okay, and talking about your endocrine system. Excuse me. Have you had any? I know your sister, you said, had diabetes. So did you get checked?
Yes.
Okay. And you have no issues with blood sugar or anything like that?
No.
And do you have any heat or cold intolerances?
No.
You don't feel like you're extra cold sometimes or extra hot when people are not?
No.
Okay, great. So I think that's it, actually. And so I'll look into your finger and we'll see what the physician has to say about it, and we'll talk about ways to prevent infection.
Okay.
All right?
All right. Thank you.
Mm-hmm.